Hi, this is Dr. Hardy here, and thank you for returning for part 3 of Boy Boobs. So in this part of the series, I'm going to talk about the management of physiologic or normal boy boobs that just is transient and will go away in time, and the pathologic boy boobs, meaning there is something wrong, there's an underlying issue, there is a problem that needs to be addressed. So with physiologic boy boobs, I usually just reassure them. I just reassure the parents that, if the boy's in puberty, he's in a certain stage of development. I showed you those diagrams in part 2, the little bit of hair growing, and then the hair gets curly, but it's not quite spread on the inner thighs yet. In those 2 stages of development, usually you'll have some transient breast growth, and then it'll disappear over a year or so. So I reassure, I observe, have them come back maybe in 6 to 12 months, take a look at it again. Of course, I tell them to come back sooner. If there's a rapid growth, it should never be a rapid growth of breast tissue. It would be slow and gradual. And like I said, most resolve within 1 to 3 years of onset. With pathologic gynecomastia, most of the time the workup starts out with labs. Then we think about medications, and then definitively surgery. So for the labs and other tests, one of the labs that is often obtained is the HCG, and that is a common hormone in women in pregnancy. That hormone is what turns pregnancy tests positive. But if we see an elevated HCG in a boy, this can alert us to a tumor, a hormone-secreting tumor. So we will look at that and talk a little bit more about that after. Thyroid function tests are another issue, especially with hyperthyroidism. Boys may also get some gynecomastia. We'll look at their testosterone level. For example, a boy in puberty should have a high testosterone level. If they're in puberty and it's low, that is a problem. That's what rises at the onset of puberty. So if you have a child in puberty, but their body isn't showing any signs of puberty in the blood work, that is a problem. And usually when the testosterone is low, it's because their testicles aren't fully developed. Their testicles aren't secreting hormones that it should be secreting. And so, there's something called hypogonadism, which basically means small gonads, small testicles, and you need to work that up. That is often associated with some genetic syndromes, I think I mentioned before, like Klinefelter's, and some other issues, other syndromes. Another test that might get done is a testicular ultrasound, because if a boy has an elevated HSG, has gynecomastia, and a mass in their scrotal sac, and the testes is like maybe one is big on one side, you worry about that hormone-secreting tumor being in the testicles. And then at the bottom it says imaging of the chest and abdomen, because you're also looking for a tumor in the chest or the abdomen. Sometimes a chest tumor can be associated with the Klinefelter's syndrome, like I said earlier. So we just start digging. So what's the least invasive? Getting a little bit of blood work, a little bit of some labs. After that, we're doing ultrasounds. After that, maybe CT scans, looking for tumors in the chest and the belly. So pharmacologic therapy, are there any medications to treat gynecomastia? No, not really. There is no FDA-approved drug to treat gynecomastia. There are some drugs that doctors will use off-label to try to help it or prevent it from progressing, especially in men with prostate cancer. They end up on medications that causes gynecomastia, and so sometimes doctors will give them another medicine to counteract that. Otherwise, another indication where you see doctors may use it off-label is if there's rapid growth in the breast tissue, the size of the breast tissue is more than 4 centimeters in diameter. That means it's pretty large. You can probably see it through a t-shirt. It might cause some psychosocial stress. So surgical therapy is the most definitive thing you can do You remove the glandular tissue. Sometimes they have to do a little liposuction around it for cosmetic purposes, and so that the skin doesn't hang and things are symmetric and even and not, lopsided. But it's sometimes done even in physiologic gynecomastia if it's greater than 4 centimeters in diameter and causing a significant amount of stress. It may also be done if it was unresponsive to medical therapy, if the gynecomastia has been ongoing for more than 2 years, or if the boy is greater than 17 years old, and if it's associated with enough psychosocial stress that it's interfering with their daily activities. And of course, you always want to rule out other causes before you go straight to surgery. So that's why the labs are done and the CTs are done and the ultrasounds. And you're looking before, to make sure it's just breast tissue, maybe for reasons like the peripheral, what we said in the actual fat gland itself. It's this machinery that's going on in there, and the actual tissue is secreting hormone like estrogens into the bloodstream, but there's no tumor. It's just the fat itself is a gland, right? It's a gland. It's like functioning. It has purpose. It's not just, like just sitting there with nothing, to do. It's actually, has a metabolic process going on inside of those fat glands. And so it may be itself secreting some estrogen, but there's no other cause. So thank you so much for tuning in. This part of the series was a little bit shorter, but don't forget to subscribe and tap the notification bell for new video alerts. And of course, you can also, put something in the comments, some topics in the comments that you may want to hear about, and I can work on that for you. Thank you.